My name is Amber Levitt. This is my final video for Advanced Health Assessment. This is my ID. It's temporary. Sorry about that. I'm going to do a room scan. I have a blank piece of paper to do my memory dump, which I'm going to do right now. So I can find a pen.
Here.
Oh, thank you. Memory dump. Okay. So, can you please state your name and your date of birth?
Chris Levitt, 9/25/77.
And do you agree to be videoed for this assessment?
Yes.
Okay. So we have a 40-year-old Caucasian male. How do you say your mood's been good? Or mood's been lately?
Good.
Okay. Mood is good. He's dressed appropriately, well groomed. He has a normal affect. So you're here for your yearly physical. We've already gone over all of your subjective history, your family history. So you have hypertension and you're on lisinopril 20 milligrams once a day.
Correct.
Okay, great. So I'm gonna get started. I am going to perform hand hygiene.
It's blurry. Geri, do it.
Oh wait, okay, there.
Okay.
Okay, I perform hand hygiene. I'm gonna put gloves on. Okay, I'm going to start with inspection of your head. He is normocephalic, no tremors or tics noted. I'm going to look at your hair, okay? Hair is thick and brown and soft. It's evenly distributed over the scalp. Any tenderness when I do this?
No.
No lumps or lacerations are noted. No infestations are noted. His face is symmetrical. Can you smile and puff out your cheeks? Cranial nerve 7 is intact. Okay, now I'm going to look at your nose. His nose is midline with his face. His septum is patent. I'm going to look at each nair. His nasal mucosa. Okay. I'm going to look at each nair. His nasal mucosa is moist and pink. No polyps are noted. Okay, Chris. I'm going to have you close your eyes. Tell me what you smell.
Alcohol.
Okay, cranial nerve 1 is intact. That's olfactory. And you can open your eyes. I'm going to have you close one nostril and breathe, and then close the other nostril and breathe. Perfect. And his nose is patent. Okay, I'm going to press on your sinuses. I want you to tell me if it's tender, okay?
Okay. No.
Okay.
No.
Frontal and maxillary sinuses are non-tender to palpation. Okay, I'm gonna look at your ears. His pinna is equal with the canthus. Is any of this tender?
No.
Lobes and mastoid process are non-tender to palpation. No edema noted, no lesions. Okay, I'm gonna look in your ear and do an ear exam, okay? The canal is free of cerumen or exudate. The tympanic membrane is pearly gray with no perforations. No fluid is noted. The cone of light is at 5 o'clock in the right ear. And I'm going to do the same in this ear. Cone of light is at 7 o'clock in the left ear. Tympanic membrane is also pearly gray and white. No exudate or cerumen noted in the external ear canal. And no perforations noted. Okay, I am going to do what is called a whisper test, and that's going to test your hearing. So I'm going to cover this ear. I'm going to whisper a word. I want you to say what I said, okay?
Okay. Purple.
Perfect.
Crippling student debt.
Perfect. Okay, so cranial nerve 8 is intact. That's the auditory nerve. Okay, we're going to move on to your eyes, okay? The eyes are symmetrical. There's no edema. The sclera is white. The conjunctiva is pink with no exudate. The irises are blue. Okay, and so I want you to follow my pen, okay? Okay, 6 cardinal fields of vision are intact. Accommodation is consensual. I want you to look over my shoulder at a point. I want you to cover one eye and the other. Excellent. Okay, just look straight up, okay? Pupils are equally round and reactive to light. Now I'm going to do an eye exam, okay? I just want you to look ahead. Okay. Perfect. Red reflexes bilaterally. Lenses are clear. The optic disc has normal margins. There's no hemorrhages, no AV nicking, and no exudate noted in the eyes. That would be cranial nerve 3, 4, and 6. Okay, so now I'm going to move on to your mouth, okay? I just want you to open your mouth. Okay. Lips and buccal mucosa, hard palate, soft palate, it's all moist and pink. He has no dental caries, no exudate or erythema is noted. Can you stick your tongue out for me? Perfect, move it side to side. Tongue movement is symmetrical, and that is cranial nerve 12, which is hypoglossal. Okay, I'm gonna look at your uvula and the back of your throat, okay? So I want you to say ah. Perfect. Uvula is midline and moves when the patient says ah. That is cranial nerve 9. That is glossopharyngeal. I'm gonna test your gag reflex, okay? Okay, perfect. Gag reflex is intact. That's cranial nerve 10, which is the vagus nerve. One more test for the eye. We would do the Snellen chart, which I would place 20 feet away from the patient. I would have him cover the left and right eye and read the smallest lines that he could read, and that would test distance visual acuity. And they also have a Rosenbaum test, which I would give to him and have him read off of that, and that would test near visual acuity. And that would test cranial nerve 2, which is the optic nerve. So I am going to palpate your lymph nodes now. I want you to let me know if anything is tender, okay?
Okay.
I'm palpating the occipital lymph nodes, the pre and post auricular lymph nodes, the anterior and posterior cervical lymph nodes, the tonsillar lymph nodes, the submandibular lymph nodes, the submental lymph nodes. Can you lift your shoulders for me? Perfect. The subclavicular lymph nodes, and then under your arms. Perfect. The axillary lymph nodes, and the epitrochlear lymph nodes. These are all non-tender and non-palpable bilaterally. Now I'm going to look at your neck, okay? The trachea is midline with the neck. The thyroid is non-tender. No nodules are noted. Carotid pulses are plus 2 bilaterally. I'm going to use the bell of the stethoscope to listen to the carotid pulse. No bruit is noted over the carotid pulse. Lean your head back for me. No jugular vein distension is noted. And if you can, I'm going to have you remove your shirt, please. So I'm going to move down to the chest. I'm going to inspect the chest. The skin is warm and dry. It's tan. AP to lateral ratio is 1:2. And I am going to listen to his lungs. His respirations are unlabored. He's not using accessory muscles. And so now I'm going to listen to his respirations. Deep breath for me. Perfect. Two more for me. Perfect. Bronchial breath sounds are heard over the trachea. Bronchovesicular sounds are heard over the left and right intercostal space. Vesicular breath sounds are heard in the peripheral lobes. And now I'm going to repeat it with him turned around. So if you could turn around for me so the camera can see your back. Thank you. Okay, deep breath. Good. And two more. Good. Okay, you can have a seat. All breath sounds are clear to auscultation. There's no wheezes, crackles, or rhonchi noted. No adventitious breath sounds are noted. Respiratory rate is 12 breaths per minute. And so now I'm going to move on to your heart. I'm going to palpate the precordium, which is right at the 5th intercostal space. And that's normal. And so you can breathe normally. I'm just going to listen to your heart, okay? I'm listening to the aortic valve. It's to the left of the the right of the sternal border at the 2nd intercostal space. S2 sound is greater than S1. And I'm going to listen to the pulmonic valve that is to the left of the sternal border at the second intercostal space. S2 is also greater than S1 in this position. I'm going to move down to the third intercostal space to Erb's point. S2 and S1 are equal. I'm going to move down to the fourth intercostal space and listen to the tricuspid valve. S1 is greater than S2 at this position. And then I'm going to move down to the fifth intercostal space and listen to the mitral valve. S1 is greater than S2 in this position. And I'm going to listen to his apical pulse.
Yes, ma'am. I just got transferred to a voicemail and it said they can't leave a voice message. Marlene? Wouldn't you have planned to need to send her for an X-ray? I know you have the facility you guys like to use.
His pulse is 74 beats a minute. And I'm going to use the bell of my stethoscope to check for murmurs.
My name is Edie, that's Y. Zero, B as in Victor, I-E. And I'm calling from Horizon Pain Management. Raymond? Yes, ma'am.
No murmurs noted, no rubs, no splits, no gallops. Okay, everything looks good. I'm going to move on to your abdominal assessment. If I could have you lie down. The skin on the abdomen is warm and pink. No lesions noted, no rashes. The contour is flat. So now I'm going to auscultate all four quadrants. I'm going to start with the right lower quadrant. Bowel sounds are normal active. The right upper quadrant. Bowel sounds are normal active. And the left upper quadrant. Bowel sounds are normal active. And the left lower quadrant. Also normal active bowel sounds. So now I'm going to percuss the abdomen in each quadrant. Tympany is noted in all four quadrants of the abdomen. Now I'm going to percuss the liver. Dullness is noted over the liver.
Yes, I'm looking for.
The liver is approximately 7 centimeters. I'm going to percuss over the spleen. Splenic dullness is noted through the 6th and 10th intercostal space. And I'm going to push on your belly. I want you to let me know if anything is tender, okay? I'm going to start with light palpation. I'm feeling for any nodules or masses. No? Okay, and now I'm going to do deep palpation. No masses are noted, no tenderness noted. Okay, you can go ahead and sit up. Thank you. Now I'm going to check your pulses. Okay. Temporal pulses are +2 bilaterally. I've already checked his carotid pulses. I'm checking his brachial pulse. That is also +2 bilaterally. And his radial pulses are +2 bilaterally. I'm going to check the, can you put your feet up here for a second just so the camera can see your feet? I'm going to check the dorsalis pedis pulse. These are both palpable, +1. And then the posterior tibial pulse. Those are also +1 bilaterally. Okay, great. Now I'm going to check your reflexes. Okay. So I want you to let me hold your arm. I'm going to test the bicep reflex. Good. I'm going to hold your arm this way. I'm going to test the tricep reflex. Okay. The brachioradialis reflex. Just let your arm hang. Good. And I'm going to do that on the other arm as well. Bend your arm. There you go. Excellent. Tricep reflex. Brachioradialis reflex. Excellent. Those are good bilaterally. I'm going to check your patellar reflex. Patellar reflex is intact. I'm going to test the Achilles reflex. I'm going to hit the Achilles. That is also intact. I'm going to have you put your feet up here for just a second. Flat. There you go. Okay. And I'm going to test. He has a normal Babinski response. Okay. Swing your legs back around. I want you to move your head left, right, up, down. Perfect. Any pain, tenderness?
No.
No? Can you move your shoulders back, forward, and your wrists, your fingers? Okay. Your knees up and down. Turn your feet in and out, up and down. Perfect. Passive range of motion and active range of motion is normal. Okay. I'm going to have you walk across the room and walk back to me, okay? Perfect. Just stand in front of me. Gait is steady and normal. No tremors noted. No drifting. Now I want you to just stand here and close your eyes for 20 seconds. I'm performing the Romberg test. Okay, you can open your eyes. Romberg test was negative, so no neurological deficits. Now I want you to turn around. I'm going to test you for scoliosis, okay? What I want you to do is bend over, touch your toes, and I want you to slowly lift back up. Perfect. No scoliosis is noted. And while I'm back here, I'm going to test for CVA tenderness. Any tenderness noted right there? No? Okay, you can have a seat. Okay, so to review the nerves in case I missed any, we did the olfactory nerve, which was his sense of smell, which was intact. Number 2 was the optic nerve. He can see the charts. Number 3 is the oculomotor nerve. He had his 6 cardinal fields of vision. That was intact. And number 4, the trochlear, was also with the fields of vision. Number 5, the trigeminal nerve, was also with the eye movement. Number 6 was the abducens. Number 7 was the facial. That's intact because he was able to smile and puff his cheeks out. Number 8 was the auditory. We decided that was intact with the whisper test. Number 9 was the glossopharyngeal nerve. That was, he's able to swallow and his uvula moves up and down. Number 10, his gag reflex is intact, so that is the vagus nerve. Number 11, can you shrug your shoulders for me? Okay, spinal accessory nerve is intact. That's number 11. And finally, cranial nerve number 12 is going to be the tongue. We saw that he was able to move that. And so that is the hypoglossal nerve. And I'm just going to think to make sure I didn't forget anything. Okay, so you're here for your physical.
Mm-hmm.
You have high blood pressure, so I think we should talk about that. Have you been testing your blood pressure at home?
Yes.
Has the blood pressure been normal?
It's been good.
Okay, good. So no side effects from your medication, nothing that you're concerned about?
No.
Okay, and you're up to date on all of your immunizations? Okay.
Yes.
Perfect. Well, then I guess I will see you next year. Thank you so much.
Thank you.